on. So first, the mission. I think it's important that one of the first words in there is people. So if we didn't have people, we wouldn't have a transportation system, and we're focused on moving people through safe, convenient, and reliable systems. And we actually used to be the Department of Highways. Many of you probably already know that. That was in 1917. So the sole purpose was to construct and build highways or to move cars. About 60 years later, we were renamed the Department of Transportation. So I just like to lay that foundation there because what that really means is multimodal. So all of those modes you see on the slides there and that focus on people. And then in terms of the vision, health, people, that's right up there in the vision. And when I think about delivering our vision, I think it's a pretty hefty lift when we consider our transportation system context and also our community context. So in terms of our transportation system, I think it's worth noting that we have one of the top 5 largest transportation systems in the US in terms of public road miles. And when it comes to just MnDOT, we own and operate just about 10% of the roads in Minnesota, which is usually a surprise for people. And I think it really points to the fact that we really need partnerships in order to make sure that our system is working well for everybody that needs to use it. And then, we're also facing a lot of pressure in responding to the climate crisis. We know that transportation is the #1 source of carbon pollution. And we also know that there's great disparities in terms of who can own and drive vehicles, which is pretty much required to get around conveniently and reliably right now. The cost of car ownership is now about $11,000 a year if you factor in the gas, the insurance, and the maintenance. So not attainable for everyone. And then in terms of community context, there's a number of significant trends that I think we should all be thinking about in our planning work. First, we're anticipating some significant growth, expecting over 1 million new residents by 2070. And we do have some changing needs based on our demographic shifts. Our oldest residents, 65 plus, are projected to double by 2030. And then we also see that communities of color are driving much of our state growth. We've had almost a 30% increase in communities of color populations since 2010. And some like to note that we're one of the healthiest states in the country, but if you start to unpack that, we actually have some of the starkest health and racial disparities, especially when we look at risk for health conditions like cancer, diabetes, and other preventable diseases, where transportation in terms of the built environment, the context it's providing, the access it's providing, certainly has a role to play. And then one of the last larger backgrounder slides, if folks haven't seen the statewide multimodal transportation plan, I would encourage you to read through that. I think the last update really put us in for some forward-thinking work. We have a big lift to implement the SMTP. It really sets the planning vision for the state and all of our modal plans that come off of the SMTP. So I just wanted to point out that healthy, equitable communities is a whole focus in the SMTP, and there's a number of different strategies that I think line up really well with the work that I'll be talking about in terms of, how do we work more creatively and thoughtfully to eliminate burdens and leverage our transportation system and work with public health partners and communities to see better health outcomes. So as mentioned, I'm with the Office of Sustainability and Public Health. We were formed 5 or 6 years ago. I joined MnDOT 4 years ago, coming most directly from the Department of Health. And we've grown really significantly since I joined. We have around 12 or 13 staff now, and are managing federal dollars and state dollars in pretty much all of the areas you see here. So working on sustainability of our own operations, how we manage our fleets, our buildings, reducing transportation carbon pollution. So things like the electric vehicle infrastructure network that we're building out, supporting transportation through integrating public health considerations, which I'll talk about. Resilience in terms of climate resilience, doing assessments and trying to figure out where are our most vulnerable assets and how do we protect those from the heavier, more frequent rainfalls especially. And then the last one, developing strategic external partnerships, really is about how do we look at our different policies and use of our right of way and creatively think through how to use that right of way space in a way that not only serves the DOT needs, but also provides community benefits. So into the public health part. So this slide actually was shared by a previous commissioner at the Department of Health when he would share his presentations about the connections across the industries. And I like to share it because, I think we continually have this challenge of being in silos, not only in our own organizations, but across agencies, across departments. And when we talk about public health, it's more than medical care. Medical care is critically important, but only about 10% of our health outcomes are actually tied back to and explained by access to medical care. When we think about what really impacts our health, we have to look at our natural and built environment, which is where public health comes into play. And public health really takes more of an upstream approach, looking at the systems that are created, our access, the policies that determine, what is in our communities, and I'll get more into that in a second here. But traditionally, public health, doesn't have as much funding as transportation and some other industries. And is really asking, can we be part of the team? And then there's transportation folks who said, well, what do you mean public health? We just build roads. But we do so much more than build roads. And so if you have one takeaway from today, it's that you as engineers, as transportation professionals, you actually are professional. You are public health professionals. You're in the driver's seat, if you will, in charge of, this infrastructure that's going to be in place for the next 50 years. And that is critically important when we think about our daily experience for how people move around and can get to what they need to be, or what they need to be healthy in their communities. So a little bit more about that. This is a framework that we worked with Dr. Yingling Fan at the University of Minnesota a couple years ago to develop. Her and her team did a literature review and then a number of interviews with different agencies in the US to understand how do we best conceptualize the connections between transportation and public health. And around the outside, we found that the social determinants of health, which is a public health viewpoint that recognizes all these non-medical factors that influence our health and equity outcomes. Those are the typical framing, and it stops there. So, access to healthcare, we mentioned, that's important. It's a small part, but it's important. Education in terms of your ability to obtain education, your family's ability, how easily you can access that in terms of financial ability as well as location. Social and community context is a big one that's hard to measure, but it's really important. Do you have someone in your neighborhood you can call on if you have an emergency? How well do you identify with your sense of place? How well do you feel supported in your community? That's extremely important. Economic stability, that's just as much about your individual economic stability as it is for your family and the community you live in. That really can unlock different kinds of opportunities for you. And then neighborhood and built environment, your access to natural green space, but also the built environment around you, and what are those exposures that could be created in terms of the environment that you live, work, and play in. So those are important. And the inner pies actually are pathways to how transportation can influence those social determinants of health. And so that's where this framework becomes a little bit more unique in terms of how MnDOT is approaching this. So social inclusion, that's listed as access to places, people, and power. That's really about who we're building for and how they're involved. So beyond the social determinants of health, thinking about our processes. How are we involving the people who are likely to be impacted the most in shaping our priorities? How are we involving decision makers in the community in our decision-making process and communicating that back to them? And then most importantly, how are we building trusted relationships with our communities and stakeholders throughout all of the work that we do? Environmental health, this pathway is really about what we're building and what exposures that we may or may not be creating. So this stems from the public health, environmental health viewpoint of protecting people from those environmental hazards. I think we're pretty familiar with this one in transportation. So we think about physical needs in terms of safety. We have a really robust Towards Zero Deaths program, Safe Routes to School, just to name a couple. And then I think a lot of opportunity with things like green infrastructure. Again, how are we using our right of way outside of the curb lines to support less exposure to environmental hazards? And then lastly, the behavioral health piece. I find this one really exciting. It's that question about how are we building things that can help people make the healthy choice the easy choice. This is we can't expect people to choose a different mode of transportation if the other modes aren't really a reliable, safe, or easy mode. So all of our multimodal work I would put into the behavioral health pathway, from how we're supporting that culture shift in communities through offering different workshops and education, to actually installing that multimodal infrastructure and maintaining it. And then again, thinking about the right of way, how are we supporting things like social and community connections? During COVID, there were some instances where local smaller towns wanted to use their right of way, where our trunk highway is their main street for things like dining on the sidewalk. So traditionally, that is not something that's allowed, and that was allowed during COVID, and I think was really beneficial, and showed us that there are different ways of doing things, and there's different ways that we can support community health. So, bottom line, healthy communities make healthy people, and transportation has a significant role to play. Um, One more slide, and then I'm going to pause to see if there's any questions just on this background or information. The other thing I'd like to stress about transportation and public health is that MnDOT and transportation overall, we have many different roles we can play in supporting healthy communities. So, in terms of leading, we have the authority to influence many measurable outcomes, and those are identified in our SMTP, whether things like filling in, gaps in our multimodal system, to offering assistance, technical assistance, or grants. The other places where I think we need to push ourselves a bit more are in the partner and support space, where we can collaborate with partners where we may not have full authority for funding or infrastructure, or limited direct authority, but can work with our partners to support our common long-term outcomes. So I'm going to pause here, and I don't see any questions in the chat. Any questions in the room before I go into the equity health assessment specifically? Okay, quiet group today. Well, feel free to raise your hand if you're online, and then I can kind of see the view in the room too. So the equity health assessment pilot project started with a conversation with our MnDOT leadership when I joined, around what are the different ways we can integrate public health evaluation into our decision-making process. So we looked at a couple of different health evaluation tools that are established. So health equity lens tools, many are probably familiar with these. A lot of organizations have their own version of an equity health or health equity lens tool. It's usually a list of questions, guides you through broader considerations when you are creating or changing policies or processes. Health impact assessments, those are often conducted parallel to a decision-making process. They're often led by a public health entity, and inputs come from primarily those who may be impacted most by the decision that's at hand. And and health impact assessments are also supported primarily through the Center for Disease Control and Prevention, so a public health foundation. And then community impact assessments, some might be familiar with, those are supported by FHWA. That's a process similar to HIA, but instead of being parallel and separate, it's an integrated process that helps evaluate and address health throughout the project process. So all three of these offer flexible, scalable approaches. There's pros and cons of each of them depending on what you're specifically looking at. At the time, this was at the start of COVID. It was the summer of 2020. And, we looked at these three. We looked at the preference for projects to apply this on. And we didn't really have any public health partners that were available, rightly so. So we couldn't conduct a straight HIA. We weren't very familiar with CIA. We haven't conducted one of those at MnDOT in the past. So we decided we'll do a hybrid version and do a pilot approach and pilot that on Highway 252, I-94, and that project. So we took important principles from each of those three. We wanted it to be community driven and also integrate both quantitative and qualitative information, knowing that when we're talking about equity and health, there's a lot that we can quantify with hard numbers, but there's also a lot that we need to lift up in terms of people's perspectives and their lived experience. We also wanted to apply some of the questions from our equity lens framework, which had just recently been finalized, and integrate the engagement through this process into the project's overall engagement effort. So these are some of the questions from the equity lens framework that we took when we were creating the overall approach and trying to identify what are the exact questions that we're seeking to get answers to. Who's going to be impacted by these decisions? Who could potentially be impacted more? What are the different social disparities that we should be aware of and considering in our decision-making process? How could our institutional norms or systems come into play? What are any potential negative social or agency outcomes? So these are all things that we were thinking about. And then a really important part was getting how are we defining things? We spent quite a bit of time making sure that, and a lot of back and forth. I know that there's some SRF staff in the room who greatly appreciate the support they provided as we waded through trying to figure this new process out for ourselves. How are we defining things? Where do those definitions come from? So MnDOT hadn't released our final SMTP yet, but we had a working definition of transportation equity, which you see in the blue there. That is new for MnDOT. I think we need to continue to lift that up. So that is the definition that we used when we talked and had the framing around equity. Health is from the World Health Organization. It's that very holistic approach to what does it mean to be healthy. And then also pulling in our vision in terms of, these things are supported institutionally and as we look outside our organization as well. So the equity health assessment, again, this was a new method for including health and equity information into the environmental review process. We articulated the importance of this as elevating equity and health priorities and the role of those priorities in the Highway 252 I-94 decisions. And we also wanted to take process learnings from this pilot EHA to help inform similar future efforts at MnDOT. So the how, we did equity and health analysis that was really guided by targeted engagement of community members and used that information then to develop and analyze project information and provide recommendations or suggestions to the project team. So I'll show you in a couple slides what exactly that looked like. In terms of the project areas, leadership chose Highway 252 I-94 as really important for this because it is one of the most racially and ethnically diverse areas of our state. We also know from the data that's available that people living in North Minneapolis do report more negative health outcomes when compared to residents in Hennepin County. And there's also higher chronic disease rates in the majority non-white areas compared to majority white areas in the corridor. And there's also greater risk of disease, hospitalization, and death due to air quality. Nearly 60% of the project area identifies as Black or African American, Asian, or Hispanic, Latino. So we knew that according to the health data and some of the other information available, that there were underserved or overburdened communities, and it's a significant project. So in terms of how we set up conducting the EHA, again, we looked to some of those established health tools that often have a core group that is implementing the health evaluation, and then there's often a community group or a group of advisors, if you will. We followed a similar structure. We found it was a little bit cumbersome in that in our Office of Sustainability and Public Health, we were leading the equity health assessment, and then our Metro project team was leading the project. And so sometimes I think it could get confusing, especially externally, when there's two different MnDOT groups working on parallel projects they're parallel and they're not necessarily integrated all the time intentionally. So that was a point that I think was a big learning for us, but we wanted to keep things a bit separate. And so I led the EHA with support of an interagency work group. So that included folks from Hennepin County, Met Transit, FHWA, Department of Health. I feel like I'm missing somebody else, but folks who had experience with health evaluation in the past. And then we pulled together a group of equity and health neighborhood advisors, or the ENA, that would bring their lived experience to the table and provide input on the data that we were researching, how we were framing it, how we were conducting our targeted engagement activities, and ultimately the assessment of the project elements and alternatives. And then we had our consultant team pull together the reports based on that input. And then those were delivered to leadership and the project advisory committee as public input through the existing process channels. So the ENA definitely is something new for MnDOT. We put a call out to community members and through community-based organizations for representatives. Ultimately, we had 12 to 15, leaning more towards the smaller number of residents in the neighborhoods along 252-94 that participated. It was an application-based process. We asked applicants to identify how they were connected in the community, what their interest was in equity and health. And overall, I think we were really successful in getting a pretty good balance of members based on the demographics. We consistently fell short with having Latinx representation, and in our targeted engagement had to work really hard to engage people. And I think that's a number of reasons. There's often engagement fatigue. This project is, we're looking really far out, and a lot of community members are worried about what's happening, today or later this week. So that was a challenge, but overall, I was really happy with the representation that we had. So we identified there would be 3 different points of input from the EHA to the project, and it looks like 3 different reports. These are all available online, and I'll just walk through highlights of these. So the first report is modeled after what's traditionally done in an HIA, which is doing more of a desktop analysis to understand what are the health conditions and disparities in the corridor communities, taking a broader view than we traditionally do in transportation. So we got guidance from the health department and from community members in terms of the data sources, how we were talking about those things, what that mapping looked like. And it's a pretty dense report. That was done in the spring of 2022. The second report built from report 1, and that took all that information and identified priorities that resonated with the community. So you'll see in a minute here, we grouped the initial data into categories, went out and did targeted engagement and asked folks, does this resonate with you? Are we missing anything? Would you prioritize things differently? Asked the community group for input as well. And then published the equity and health priorities piece, which then could be taken by the project team as another input in the decision-making process. And then the third report was an equity health assessment based on those priorities of the project elements and alternatives with recommendations for MnDOT to consider that were submitted during the public review, public input process. So the first report was, like I mentioned, pretty dense. There were over 30 equity and health baseline conditions that were in there. Really holistic depiction of how transportation was impacting the corridor communities, thinking about physical, mental, social, environmental, and economic health factors. And whenever possible, we tried to disaggregate by race, ethnicity, income, things like that, and also assess health disparities within the corridor and also between the corridor and the region to put things in perspective. So as I mentioned, that first report, really dense, it served for the foundation of reports 2 and 3. And report 2, these are the focus areas that we identified. And when we went out to talk to community members about these, we ended up not making any changes to the overall headers of these. There were some small adjustments in terms of what we were or were not including to define some of these, but overall they seem to resonate pretty well. So, environmental, human health, things like air and water quality, sense of community came up quite often. How is the transportation facility contributing to sense of place, community cohesion? Property impacts is always a big one. Thinking not only about land value, but livability, access to nearby destinations. Transportation safety, that's about physical safety as well as mentally feeling safe on the roadway in different modes. Transportation choice, that's pretty self-explanatory about transportation options. And then the last one proved really important, being able to access destinations that support their health and well-being, including things like healthy food options, green space, access to jobs. And I know this can be kind of tough sometimes when we hear things like this because it's like, well, the DOT doesn't impact land use, right? But if you think back to the lead partner support, we may not have jurisdiction over land use, but we sit at a lot of tables with folks who do. So we can facilitate those conversations, share what we're learning, and do more coordinated planning when it comes to our projects and the land use and destinations around them. In that second report, we had about 209 responses from BIPOC individuals. About 153 were from BIPOC individuals living in the neighborhood. We had pretty good representation from the 3 different cities, Brooklyn Park, Brooklyn Center, and Minneapolis. So overall, pretty happy with the engagement results that we saw there. And then specific to BIPOC communities, because that really was a focus of the work, we pulled out their responses to see if there were any differences when we look at BIPOC as compared to Caucasian white responses. And we did find that the access to jobs, healthy food and green space was most often selected as a top priority for BIPOC participants, much notably higher than white participants in the project area. And then some of the key takeaways from the conversations with those residents, there was concern about expansion and any increase in traffic, air pollution, and exacerbation of respiratory issues that are already higher in these corridor communities. Safety and making sure that, overall who's benefiting from the project, making sure that local communities aren't unfairly burdened. And that's a tension we continue to see in terms of, the trunk highway system often it's a corridor, you're pushing throughput, but these are also transportation facilities that are in communities, and we don't want them to serve as barriers for people who are in the community trying to go along and across. So that's something that we'll always have to contend with. And then the third report, so there were three overarching priorities that were identified. These had the recommendations for the project team. Um, and the first one, community livability, thinking about all those, how it was defined by engagement in the ENA group in terms of, not only is it the traffic volume and speed and the environmental exposures, it's about access to community resources, livability, well-being. And with each of these priority areas, we had a member of the ENA group that provided a little clip from their lived experience in the community about what it meant to them. So you're welcome to go online and check those out. The second one was about roadway safety. So again, not only physically feeling safe, also about mentally feeling safe. And that's particularly true for multimodal. And then the last focus area is transportation equity. So really targeting in on the equitable distribution of the project benefits and burdens, and the group wanted to really make sure that the project team was considering the benefits and burdens for the local community. So some reflections from the EHA. So the last report was delivered during the SDD public comment period last spring, last spring, summer. And we are now in the DEIS phase. We're starting to debrief and really think about, what does this look like as we transition into the DEIS phase? So from the MIPA phase into the NEPA phase, what does it look like for the project? But also, what does it look like for MnDOT and how we could shape or deploy something similar to this on other projects? So a couple of insights. It's really important to identify roles and ownership from the start and keep clarifying those. That's something we needed to continually do as we had staff change, as we, started down the road and got into this process that was new to us, and unexpected things came up, and we had questions. Who gets to review that content? Who signs off on it? There were some challenges because we hosted and still do host the EHA information on our MnDOT website. So some could misconstrue that it's MnDOT endorsed. Traditionally, EHAs are hosted by a public health entity or on another organization's website. So we had to work through that in terms of how is it branded, making sure that it's clear that this information comes from a community group. But I would go back and work with the community group earlier and have them help us shape the process more. We came up with a lot of the process, based on these other methodologies, and came in and, coached the community through it, if you will. But in the end, we heard they really wanted to be involved earlier and have more of a say in creating the process from the start. Connecting on shared values. Public health is a really great way to connect over adversarial approaches. So this is something that I've noticed in many different settings when I've come from Department of Health and now I'm at transportation. Everybody wants, the ability to be healthy. Everybody wants their community members to be healthy. I think public health has a little bit less baggage than maybe transportation and some of our other agencies. So when we were able to pull in public health partners to review our data, to review our approaches, it went a long way with our partners and with the community members. And then being intentional about who's at the table, who's facilitating, how meetings are run. We spent quite a bit of time trying to get the community members up to speed on our really complex transportation processes. We have a lot of acronyms, and I think sometimes that became really overwhelming for folks. Community members, if they're meeting, we had our meetings in the evening. We often provided food. We offered stipends if folks wanted to take advantage of that. Those are good, and those are a good first step. But really thinking about how you're shaping those discussions. Community members don't want to come to a meeting. They want to come somewhere to talk and be heard. We had a facilitator from Cura who was, more of a neutral facilitator, and then MnDOT staff, including myself, were there to mostly listen, ask technical process questions. it's really helpful to have a neutral facilitator, but then also have the agency members show up and show that they care and they're there through the process. And then setting expectations again and again. So we, had some challenges with everyone being clear about the EHA process. I think one, because it was new and sometimes we were figuring it out as we went along, which caused some confusion. But then also, I think, some folks wanted it to be something different than it could be. We had decided from the beginning that the input would fit into the project process at the public comment period. That was reiterated over and over. In the end, I don't think that was enough for some of the community members. So that's something that we'll just have to continue to contend with. But I think the more that we can clearly communicate from the start, what influence this process will have, what the role of everyone is, the better off we'll be. So where we're at with the EHA, so the community group is not continuing as a formal group in the DEIS phase. We've met with them a couple months ago and talked through kind of wrapping up their involvement during the SDD phase. The project team is looking at how can we address some of those ENA recommendations in the DEIS analysis, embedding some of those recommendations, and some of those might also be elevated alongside the DEIS process. Again, when we think about MnDOT as a partner or supporter. And then as part of that too, there's a lot in public engagement. So the project team is re-envisioning what that public engagement strategy looks like, focusing more on community-based organizations and working through those trusted relationships for engagement. And then you were keeping in touch with the ENA members through regular communication and hoping that they'll continue to participate in engagement activities. And then outside of the project, we're continuing to identify how does an EHA type effort fit in for other projects? How does it align with the MnDOT livability initiative that's coming out of Metro? There's a lot of similarities and we don't want to trip over ourselves there. So we're trying to figure out with other districts and other projects too, do we want to do another process like this? And what would that look like? So that is what I have for you all today and would welcome questions or comments.
I'll maybe start out. Nissa, can you hear me all right?
Yep.
So what is kind of the first step of such a divisive project where, there's stakeholders coming in that want to expand capacity on a highway versus the impacts it makes to the community? How do you end up taking those impacts and recommendations into a project that's being brought forth by engineers trying to solve safety, operational challenges that's probably going to be a result of interchanges or some type of traffic improvement? How do you work with a community to expect something like that, but at the same time taking an input to address the specific challenges of that community?
Yeah. Yeah. I mean, there's no easy answer there. I think we're always going to have the challenge that not everyone's going to be happy, right? Not everyone's going to get what they want. I think we need to fall back on really clear and consistent listening and communication. So one thing that I've talked about with the project team moving forward and in terms of something that we really want to focus on is clearly communicating. We heard X, and this is what we're doing about it. Either we can do something, and here's what we're doing, or either we can't, and this is why. But being very clear and circling back on, we heard you, and this is where we stand, and being okay with not being able to satisfy everyone's requirements, right? Because sometimes we can get stuck in this loop of, you know, different sources of input, and we have different maybe values or definitions tied to like what does safety mean, especially. So also being really clear on here's how we're defining things and here's why. And being open to having those somewhat uncomfortable conversations. I think that was a big learning too from this process is needing to make sure that all of us feel comfortable and not personally attacked, which can be hard when you're in those spaces. to, you know, have a lot of empathy and think about where these folks are coming from. It's their community, it's their backyard. We don't know what kind of interactions they've had with government in the past. We know that there's been a lot of situations where, you fill out the comment box and you never see what happens with it. And that's frustrating for people. So I think acknowledging and trying to understand the frustration points of folks, and then also following up with that clear, we heard you, here's what we can or cannot do, is a great first step. I don't know if I answered your question. All right. Other questions, comments?
I've got one. You had mentioned the use of a neutral mediator. Did you end up using one, and was that another agency or neighborhood group or consulting firm that specializes in engagement and mediation?
Yeah, great question. So we did enter into a contract with CURAS, the Center for Urban and Regional Affairs. We were looking for somebody who, in an organization who had good relationships already in the community, knowing that there's a lot of mistrust of government, and also we, in terms of this project, politically it was tough for MnDOT. So we needed to find somebody that could take that mutual ground. So C. Terrence Anderson from Cura was the facilitator of the ENA group. So we would meet with him, help pull together the agenda. That's also where, in terms of process learnings, I think it would be helpful if we do something like this again to have like community kind of co-chairs that would help set the agenda, give them a little bit more control over what those meetings and discussions look like. But C. Terrence was really great in terms of being able to pivot and take the temperature of the room and give the community the time they needed to focus on what was at hand so that we could get to the work, and reframing things so that they didn't get personal, right? So I would recommend, if you know that you're going to have tough conversations and you're looking to build rapport with community, to find somebody who's trusted, has relationships, and help you build those relationships then with the community.
Thank you.
Yep. Other questions? Yeah. In the back.
How would you look at applying this more to rural communities? I've got an example down in Worthington where it's one of the most diverse small communities within Minnesota. How could, us as a group take that out to more rural projects throughout the state?
Yeah. So I've been talking to a couple of district engineers about like what could this look like elsewhere. I will say that the EHA was very time and resource intensive, I think because it was new and we were figuring things out, and figuring out process. I think a less resource intensive approach that we could take on all of our projects is really to focus on that equitable engagement piece, and take a lot more time at the beginning to identify who are those community stewards that are trusted in the different communities within those project areas, building relationships with them, and going to where they're at, right? Like going to the school nights and the open community center open houses and the apartment buildings and farmers markets, and starting the engagement early, finding out what their priorities are, and then going back to the earlier question, feeding that back to them, right? Like we heard you a few months ago say X, Y, and Z were important. Here's what we can do on this project, versus going out to communities with, here's options A, B, and C. Which one do you like? If we're going to build rapport with communities and actually meet their access and health and well-being priorities, we need to understand what those are from their viewpoint, right? So I think taking that earlier approach and pushing our project staff to do that. I know it comes down to scope, schedule, budget often, but we're pushing that internally too. Is like how we need to push earlier and earlier in the planning phase so that we're right sizing our projects, so that we're bringing the community considerations in before we decide what all that project entails. The other thing I would mention on that too is I'm working with a couple of districts, D3 in particular. D4 already does this really well in building relationships with their local public health professionals. So Department of Health provides grants to have a coordinator in each county through their statewide health improvement program. And one of the focus areas of those coordinators is active transportation, active living. And when we've gotten those local coordinators involved, we've been able to do a lot more like vision setting earlier on, get the community comfortable with, the transportation engagement process, the project process, getting them familiar with terms like complete streets, why we might be proposing bike lanes, sidewalks, things like that, and have been able to have more holistic multimodal projects, if you will, when we've brought public health to the table early on to help with that engagement and conversation setting. So if folks are interested in that too, that's something that we're kind of building out those connections and processes with our districts, but I'd be happy to help with that too.
So Nissa, I have a question. This is Marie.
Yeah, hi.
So I was fortunate to work with Nissa on the EHA. I was brought in later, and one of the questions, do you think that, and I will say I am an engineer, just like all of you, and a traffic engineer. Is there a benefit to have the EHA run by a transportation planner? Or at least, right, an engineer who thinks like a planner, because one of the biggest challenges is, I know a lot of safety data, right? I mean, the safety of a freeway over a corridor with signals, and when you're meeting with the community, you cannot give that answer. And that actually makes them even more mad about safety. Well, and you spit out your statistics, and you really had to retrain yourself to not talk like a traffic engineer, because it's a whole different way of what that word means to them. So this is just a thought, but as you follow up and have conversations, has there been a discussion of what type of skill, again, like the planning side versus the engineering side, for this type of work?
Yeah, that has come up. And I think, one of the things that we recognize is we're putting a lot on our project managers and engineers, understand the data, communicate about the data, go out and represent and be the face of MnDOT at these public meetings, go meet with public officials. That's a really big skill set. And we need to provide the right kind of training to equip people to do that. Referencing back to having hard conversations. Marie, we were in a lot of really hard conversations with the ENA and with others on this project. And that's a muscle that like grows over time, right? And not everybody's comfortable with that. And so we've started talking about, like, in terms of debrief, doing this again, and that would definitely be one of those things, is who are we putting in what roles? How are we equipping them with the right skills? Like, we need all of those skills, right? It's a matter of putting them to use at the right time. So I do think having someone who is adept at having critical conversations, if you will. I know we have that training at MnDOT. That was really helpful for me. But then also the data side of things. Yeah, think really strategically about how you build that team.
Any final questions?
Nissa, this is Amber. I've been sitting in the back.
Hello.
Just wanted to say that we're still learning on this process. If you don't know I'm Amber Blanchard with MnDOT. I am the project manager now for 25294. So we're still learning, and we're trying to develop this process even more and improve it even more. So Nissa and I talk a lot, and we're going to be collaborating here in the future to see what we can do.
Yep, and many kudos to Amber for bringing the EHA recommendations. We're really looking at those and figuring out what can we carry forward, how can we do that, how can we reference back to that work. So
Thanks,
process.
Nissa.
Yep, process is underway. All right. Well, thank you, everyone. Again, so my email's on the screen. If folks have follow-up questions or just things that they want to ping me about, please do reach out.
Thanks, Nissa, for taking the time, especially
You
with
bet.
sick kids and whatnot juggling. So appreciate you pivoting and still presenting.
Yeah, thank you for the flexibility.
Looks like we're right on time here for wrapping up the meeting. Again, just want to thank everyone for coming out. I think there's extra food there so for real, anyone that wants to take food, snag it. I don't think anyone else, MnDOT wants it here, but if not, do that. Look for an email coming out here in the next couple of weeks for an April section meeting. We'll get that on the calendar as well as the training for ethics. So hope to see you at future events here in the spring. Hope you have a good rest of the day.